My name is Julie Roca, and you have found the podcast Aging Gracefully with Julie Roca. Surgery is one of those things that most of us never want to experience. But as we age, the chances are good that at some point we're going to have some kind of surgery. I mean, I'm getting ready to have oral surgery next month. Yippee skippy. But it's nerve-wracking. And if you don't know how to well prepare and you're not in the healthcare world, it can really cause some anxiety. So today I have brought my friend Fernanda Thompson, but I never call you that. I call you Fern. So she is actually an RN, and she specializes in helping people that are going through maybe a surgery or some other healthcare crisis. So tell me a little bit about you and welcome.
Thanks so much for having me, Julie. So I am, like you mentioned, I've been a registered nurse. May will be 14 years.
Okay.
And I worked in the traditional hospital setting, mostly with the bulk of my experience being within the surgical continuum. So I was either helping patients getting ready, like stabilizing them so they can have surgery. I also did preparing them for surgery or helping them recover after anesthesia. So a lot of my experience was really during that time. After COVID, I just started feeling that I wasn't aligned with the healthcare system a lot. There was a lot of changes going on. And then eventually, I started looking for new opportunities, working with patients one-on-one to be able to really optimize their care and not being constrained within a model.
Right. Yeah.
So that's where I ended up coming in, really helping clients and then taking that surgical knowledge and being like, how can we use this to your advantage? And really just started creating a program that helps take them through the process and helps minimize risk and increase the outcomes.
Yeah. Awesome. Awesome. You're working with a great group. You're an independent contractor, right?
So I have my own business where we're working on optimizing, but then I also contract with another patient advocacy company.
Yep.
So we're kind of meeting patients from all aspects, whether that's they're in the ICU under crisis, acute hospitalization, but also at home. Trying to get healthy so they can live their best life. And
Gotcha.
so we kind of sister and partner together with the companies.
Gotcha. And you don't only work with people that are aging, you have worked with all ages.
Yes, yeah. So as a nurse, I did have like pretty vast experience, and my partner also. So we do peds to my oldest client right now was 94 years old. So
Okay. And so is surgery different as we age?
Yes. Oh my gosh. So great question. So surgery is very taxing on the body, on the heart and lungs.
Yes.
It puts it through a lot of stress. Doesn't matter what age we're in, but it happens to correlate that as we get older, our health happens to decline as well, just a natural decline. And right now, what we're currently seeing in the hospital sector is patients are sicker than ever. So we're having
Yes.
2 or 3 comorbidities. So we're having heart failure, diabetes, renal failure, all in one patient.
Just a little segue. Do you think that's maybe because of isolation and COVID there, that people didn't go out to the doctors for a while? And now do you think that may be part of why? I mean, you don't have to give like an expert opinion, but just your thought.
It could. I think one of the things, too, that we saw with COVID is, like you said, people aren't going out. So our activity has also been reduced, right?
Yep.
And with that, like when we go to surgery and to circle back over to that, when we decrease activity, our heart is no longer getting that healthy stress that we get from being active daily lifestyle. So then that does increase the risk for all these surgical complications, not doing well with anesthesia, having increased risk for pneumonia, blood clots, all these things. And I don't say that to scare anyone, but when we have the knowledge, then we're able to put in systems in place.
Yes, and we're able to work towards better quality of life by maybe getting up and moving.
Yeah, absolutely.
Maybe getting out and rather than maybe having someone deliver your groceries, maybe it is smarter to go and make the effort, get out of the house and pick them up. So
Yes,
back
absolutely.
to what we were talking about, surgery being different as we age.
Yeah. So really we touched on activity. We do also see increased risk. So increased risk with surgical complications, pneumonia, right?
Right.
Blood clots and things like that. Also, too, a lot of our aging population doesn't have a strong support system. Maybe the kids are living out of state, or a lot still want to be very independent. And so then we don't have that support during that recovery period, right?
Oh, yeah.
So
Yeah.
food, we're not moving around the house, increased risk for falls and things like that. So during the surgical time, it's a good time to bring in all those extra services, ask for help, if you do have a support system, bring them in.
Yeah.
And not try to, I'm going to do this all by myself.
Well, and I mean, not to shamelessly plug you, but that is kind of what you do. So I don't even know what I'm looking at. I am not medical. I don't have a degree in nursing. I don't have a degree in, I'm not even a CNA, a certified nurse's assistant. So I don't know what I'm looking at when my loved one is recovering. So pulling someone in that can look at those charts and actually see what's going on could be so beneficial.
Yeah, and so one of the benefits of having someone advocating in that role, they're able to kind of get the red flags that might be, they're anticipating. Let's say, hey, we might see that you might likely get pneumonia after, or you're going to have a lot of pain. So let's get someone in here to come support you during that time when you're not going to be able to wash the dishes or do the laundry or do these things. And it's just a bird's eye view of being like, hey, let's look at these. Let's find a way to anticipate those needs, how we can fix them so that you have an easier transition, right?
Yes, for
Because
sure.
so many times we take the burden on ourselves, but there's an easier way sometimes when we bring in that extra.
Yes. And sometimes, so this goes to my field a little bit, I do the placement side of things. And I have placed people for a minimum of 1 month to help them kind of get that extra support and help that they need in an assisted living scenario, and even up to 3 and 4 months. So they're not necessarily making a life change and they're moving into assisted living and selling all of their things off. They're simply coming because it's a more home-like environment to be able to recuperate and build that strength up, and they don't have to worry about meal preps and laundry and housekeeping and those simple things while they're building strength.
Yes, and that completely makes sense, especially too, like I mentioned, the population that doesn't have a great support system. Because I have had experiences where we have some seniors that because they lack the support system, they live too far out in the country away from these resources, they're not having consistent meals.
Right.
Maybe the meals are not the healthiest. And so as we're trying to recover, that's also a concern that we have, right? If the meals aren't the healthiest and your body is doing this amazing work trying to heal itself, but you're also not feeding it well, then we have sometimes where increased risk of infection and things like that, impaired wound healing. And so that's a good way to problem solve and be able to meet the needs, right? Someone's helping with laundry, there's food available consistently, right? And then you have someone checking up on you also, and you have staff. If there's any complications, there's someone to be able to be like, hey, we need some help.
And that's 24 hours a day.
Right,
So it's not like, you've got a kid that is grown up and they're caring for you, but they're getting up and they're going to work in the morning, and so they kind of need sleep at night. So I've found that to be a really great way to help people to transition from surgery to getting back on their feet. So those are for after, but what tips do you have for patients that are kind of preparing for surgery?
Yeah, so this is I have 5 general ones that are going to speak to everyone in mostly across the board. Whether you're not super healthy or super healthy, one of these things will help. The first general one's being an active participant within your care. So when you're having the conversation with your doctors and they're saying, I think surgery is a good option for you. The big thing I say in being an active participant is do the research or have someone help you do the research. Find the best surgeon you can in that area. Google has amazing resources. Write down some questions. Bring those questions to each of the consults that you have and the surgeons so that you have a good baseline of what you're looking at to evaluate.
And also, I recommend sometimes when there's a lot of information being shared back and forth, record it. Yeah. We all have these little devices tucked away in a purse or a pocket. Pull it out and record it so you have it to listen to later. So you have it to share with your support if they weren't able to make it with you.
Yeah, absolutely.
So those things I think are helpful. What about second and third opinions? Do you think that those are good ideas?
Yes. So I have a great story for that, actually. I always say at least 2 opinions, minimum. And that's because I'll give you an example of one of my clients. He had a hernia kind of between his groin and his leg. So we call them inguinal hernias. And the first surgeon he went to, I was unable to attend that appointment, so it was him and his wife. And the first surgeon that was at the consult had gone through his whole history and everything like that, and then said, you know what, you're too high of a risk. You should just wait to have this operated. But his issues were that the hernia was creating shooting pains to his leg, and it had a pretty, about an inch to an inch and a half of the intestine was kind of poking through there.
Ooh, so quality of life was definitely,
And so for him, he was like, well, I'm not getting any younger. My health is not going to get any better than where I'm at. And then if we wait, then it could be a bigger complication than where we're at now. So I agreed with him in that stance. And so we came to a second doctor. Now, I did know this client, his history, back and forth, and he was at no higher risk than most people. Now, he was at a higher risk for infection, but not for adverse anesthesia and surgical risk effects. So from there, we took him to a second surgeon, and the surgeon was like, yes, let's operate. You're fine. Infection's our biggest concern, and we're going to talk through steps that we can do to mitigate that. We had that very open conversation, and that's where if we stopped at that first surgeon,
he would have been miserable.
Yes, miserable, yeah. But then if he waited longer and this intestine became trapped and things like that, we would be looking at such a bigger, complicated surgery than the overnight stay that he had at the hospital for this surgery,
Wow. Yeah.
So that second opinion really is valuable.
That is definitely taking that active participation, is seeking out a second and possibly a third.
Yeah, absolutely.
So what are some of those other steps that you have?
So these are going to be more of lifestyle tips. And so one is really increasing our daily movement, right? So as I alluded to before, surgery is very taxing on the heart and the lungs.
Right.
And activity helps mimic that as best as possible. So in that, it can be exercise of walking. It can be anything that we're able to do. But we want to push the limits a little bit, right? So some seniors I have, their activity is considered within the household. So if that's where you're at, let's push it a little bit. Let's get down to the driveway. Let's get to the mailbox. Let's push it because we want our heart and our lungs to kind of have that extra stress.
Gotcha.
Because that's what it's going to receive during surgery. Now, if we're walking, let's walk a little bit further. Let's make a loop around the neighborhood and then slowly progress to making extra steps. And even sometimes I have people who are within the wheelchair limited, and there's things that we can do with that too, right? We can do little hand exercises, leg exercises, and that is also going to mimic stress for the heart and lungs. So any form of increased movement really, really helps with mimicking the surgery, but also decreasing the risk for all kinds of things, including pneumonia, increased infections, blood clots.
Yeah.
So it just is one of those overall health things.
The heart is stronger. All the other things are going to be stronger as well.
Yes, absolutely. Yeah. And it's going to give you out of recovery. There's a level of functionality that you get if we push our limits a little bit, then we're able to. The decreased functionality that you get after surgery isn't going to be huge, right? It's going to be just a little bit less than where we're at. But if I wasn't doing anything in the first place or wasn't doing very much, that's going to be impacted even greater after.
Yeah, so your baseline maybe is not ever even going to get back to where it was prior to you needing the surgery. It may stay down
lower,
here
right?
and lower. Oh, that's impactful. I mean, even you and I can be impacted by that now. Mm-hmm. The more we move, the more we keep our hearts strong, the better we're going to be able to handle any crisis that we come upon. Because, as I mentioned, chances are real good you're going to have a surgery at some point in your life as you age, because health just does decrease unless you're in a major accident and suddenly lose your life.
Right. Yeah.
So what are some of the other keys?
So from there, then we go to a balanced diet and hydration. So I know this is like people are going to roll their eyes with the balanced diet and everything. But when we look at surgery in the spectrum, there's some stats out there that are saying that going through surgery is a reciprocal of working out, running for 2.5 hours. So with that, we're looking at how much caloric, you've just burned all this energy going to surgery. And so it's really important to be able to feed yourself good foods. But then also we're going to tie in the amount of healing that occurs during surgery. And if we're trying to avoid infection and improve how my body heals, we have to put the food that is going to allow that. So that's going to be increased proteins, fiber, and we want to control the blood sugar because there are certain surgeries that if your blood sugar is too high, they will cancel the day of.
Oh, wow. Okay.
Yes.
And I noticed that a lot of families want to spoil their loved ones a little bit. So I'll come into the hospital after surgery sometimes and I'll see little cakes from Publix or Twinkies. So you're saying no.
Yeah, or minimize it. Let's minimize it as much as possible. Now, definitely if your loved one is diabetic and it's not controlled, I'm like, let's try to minimize that as much as possible because especially when we're uncontrolled diabetes and things like that, I've, as a nurse, treated so many surgical patients that have come back to the hospital and have impaired wound healing and infection because a high sugar environment is a breeding ground for bacteria, germs, and all of this. So then they're in the back in the hospital after surgery because they have a wound that's not healing and it's infected. Now we need big, heavy-duty dressing changes that take nurses to do, sometimes 2, 3 times a day. And then on top, we need heavy-duty antibiotics to take care of the infection that happens.
And chances are good you may not be able to go straight home after that you're going to need some time in a skilled nursing facility at that point if that wound is really...
Yes.
Is really deep and wide. You're going to need some time in a skilled nursing facility, which not too many people want to experience.
Yeah. I mean, that's the realities of what can happen, right?
Yep.
And most people want to go home and get back to life as quickly as possible and then also reap the benefits of the surgery they just had.
Right.
Yeah. The other thing I recommend is hydration. As we get older, hydration just isn't. It's just one of those things that just drop off as a priority.
Yeah.
A lot of the senior demographic going into surgery is really dehydrated. And so a problem that happens when we're in surgery is that us as medical providers, we're having to rehydrate a person that's been dehydrated for
rapidly.
Yes. Yeah. And we're doing it in 2 hours, 3 hours, however long the surgery is. And so now the body's suddenly inundated with all this fluid and it just creates more complications. So if we can do hydration daily and then come to surgery without having to overhydrate someone, you have a better outcome because recovery does get more complicated when now we send you home, you're super hydrated, but your body can't compensate that quickly for it.
Right.
So those are some tips that really help make recovery a lot easier.
So I know that for me, the regulation for hydrating is I'm supposed to drink half my body weight in ounces for water. That seems like a lot of water for your average senior that's not super active in a day.
Yeah.
What do they recommend for your average senior to be consuming as far as, I would say water, not coffee doesn't count, does it?
Oh, yes. So, yeah, let's touch on that. So, yes, so coffees or sodas aren't like the best source of hydration.
What are you
And I
saying
know
right now?
our seniors are also to come from a generation that coffee is like a hallmark of it, right?
Yeah.
So yes, that's not a hydration, and we're talking about water. And so some doctors, we've had this discussion, and so they're like, until you feel that you, like, base it on how you are feeling. And I can't give you a hard and fast number of saying, hey, because as we also get older, we have some like heart failure or renal failure where we can't
limited.
Yes.
Yeah.
So we try to base it on the senses too, right? So like if our tongue's super dry, it's letting us know we're dehydrated. So urine's a great way to also monitor. If our urine's very, very concentrated and yellow, then we're probably dehydrated.
And that brings up another point because, in the dementia world, a lot of times our dementia patients can't tell what's going on. They don't know if their tongue is dry or not. Some of them may even forget how to pick up a cup and put it in their mouth. Some of them may see a cup there and not realize what that is and how it can meet their needs. So, when loved ones are watching, sometimes I'll get calls and they'll say, I don't feel like my loved one is drinking enough. But that's a great way to find out if their urine is really dark colored, if you can see dryness in their mouth, that's a really good sign they're not getting enough.
Yeah.
What are some of the other signs that they may not be getting enough? Can you think of any?
So another one that comes to mind, lips are a good indicator too, if they're very cracked, dried. Sometimes we even see to extent that they have very dry eyes. That could be medication induced too. We also, as medical professionals, look at what we call skin tinting, where we pinch the skin of the hand. And so if it retracts quickly, we know, okay, they're pretty hydrated. That gets a little bit as we get older, we lose elasticity. Right.
Well
we have some elasticity issues there. So that one gets a little. I leave that one to the
professionals,
to the medical, because there are times where it's just the skin just changes with time, and we can't use that as a form.
So what I'm hearing then in this conversation is basically watch for those key elements like the staining of the urine, like the dryness of the mouth. It's pretty common sense stuff, right? And then make sure you're speaking to the primary care physician because they may not be able to consume half of their body weight in ounces. That could maybe be very harmful for them. So depending on what their conditions are. Yeah,
that's so if they have that heart failure, renal failure, that's definitely a conversation that needs to be had with their providers. So that will be my little asterisk right there of being.
Yeah, for sure. So what else do you have on your list?
All right. So another thing, breathing. And one of the comments that I get frequently is, why do I breathe all the time? Why is that a tip? Like, what's behind this? So when we have surgery, your lungs go to sleep. And so the anesthesiologists are helping breathe for you during that time with their equipment. And in that, when you wake back up, we have to remobilize the lungs and everything like that.
Wow.
Okay? So if we practice breathing exercises in the hospital, they also have an incentospirometer, which is this little device that they have, and you suck the air in it and brings it. All of those are to help you expand your lungs as much as possible because, one, it helps pop everything up so you're breathing better.
Yeah.
We love air.
Great.
And then number two, it also helps decrease risks for pneumonia. And that's a huge thing with surgery and the senior population.
Yes,
so by doing these exercises before surgery, we're coming in, probably not going to have too much mucus in there, and we're aerating well. Then we can go to surgery, the lungs can do everything they do during surgery, and then you come out to recovery and you already have an idea of what you're supposed to be doing when you're just waking up sedated from medications, but you know what they're talking about.
Yeah.
With that too, the breathing just really is excellent for pain control too. It helps release great hormones that can help reduce some of the pain. So it has a lot of factors that can really help people.
And it can really just help you to be calmer. I know that sometimes when I'm really stressed out, I will breathe. Angela Dragon, I think you've met her before. She was talking the other day about doing 2x breathing. So that means if you're going to breathe in for 3 seconds, breathe out for 6 seconds. And so that was the first time I tried that, but I have done the box breathing a lot where you breathe in for 4 seconds, hold for 4 seconds, release for 4 seconds, and then repeat. Yeah. And that one is one that has definitely helped me over the years. If I'm stressed out, it just helps to calm me down and I can feel my heart settling in. And a lot of times if it happens in the middle of the night and I do that breathing, I can get myself back to sleep.
Yeah. So it's funny that you bring those up. And so similarly, when we're doing these breathings, we're not going to just inhale and exhale, however. So it sounds funny. And I love that you brought up these specific types of breathing, breath work. When we're doing it for this setting, we're going to inhale, similarly to the box breathing, hold the breath as long as you can.
Ooh, okay.
But then also, too, we want to slowly exhale instead of just like the whoosh, because that will close everything back up in that setting. So we let it out slowly, and that helps just pop everything back up. You're going to breathe better. When you're in recovery, it's those oxygen numbers that keep beeping, and those are going to be much better. It decreases your risk for pneumonia afterwards. It helps mobilize those secretions, and those beautiful effects that you said to help reduce stress and everything. Yeah. And that was a perfect segue into my next tip, which was stress management. Because surgery is very stressful. Whenever it's on the radar, we tense up, right?
Oh, yeah.
Absolutely. This is not something we're looking forward to. The implications can be great sometimes, right? Depending on why you're having surgery. And really for the time leading up to your surgical date, I tell my clients, I'm like, you're going to be stressed out.
Yeah, you can't help it.
Yes. And so we have to put systems in place to be able to be ready for when that stress comes. Because stress is, number one, it's going to impact your immunity.
Yes.
And we're going to go into surgery with a decreased immune system? No. What? The big no. Yeah. So impacts your immunity, impacts your sleep, right? And then all of those things will increase inflammation to your body, and they'll just not create the best milieu or environment for the surgeon to come into, right? So if we can decrease stress, whether it's through journaling, yoga, meditation, depending, some big surgeries will actually have like support groups where you can go and talk to people and they had the surgery, and that helps also reinforce you, right? Having a team that you believe in is helpful. Yeah. All of these things are just like things that we can do to really provide us with more positive feelings, increase those positive feelings as well, and decrease the stress, and then we go into surgery a little bit better than what we're coming.
Which is awesome. And if you can do all 5 of these things, what do you think that effect is going to have?
So what we're seeing with our clients when we start incorporating these things is we're seeing clients, my senior clients, are having decreased hospital time. Right.
Oh, that's great. Yes. They're going home.
They're going home.
Do.
Yes. We're even seeing pain levels are decreased. We're looking at 2 to 3 days. Most of mine by day 3 are not on narcotics anymore, which is so crucial for some of our seniors because those narcotics are super sedating. It can create a cascade of issues too with falls, all of those things, right?
And the pneumonia again.
Yes. Yeah, bed sores, all of this, right?
Yes.
If we're overly sedated and things like that. So we're seeing less opiates being used, getting back to life more quickly, right? And decrease risk of the side effects that we were looking at of impaired wound healing and infection.
Yes.
Which just means we get to live our life sooner and experience the results of our surgery, hopefully the positive results that we were wanting to get from it.
I'm glad you mentioned the positive results of our surgery because I don't think a lot of people think about that.
Yeah.
I think a lot of people are so dreading the surgery itself that they don't sit there and focus on, hey, when I'm through this, what are the positive results? What are my goals when I get through surgery? And I think that's important because that's going to help you to breathe better. That's going to help your stress management. So.
Yeah, and that's actually one of the journaling things that I recommend to clients to have for the stress management thing, because when we can focus on what is the surgery going to give us at the end of it, like why am I having it and what results am I seeking from it? Then our mind starts to follow in that path, right? And there's plenty of research and studies going on where like our mind is, placebo effect, all of these things. Once we start visualizing, hey, this is a positive outcome of what we're getting, we're more likely to start following that.
Yeah.
So it's very, very, very helpful to do.
Yeah, that is. Well, so we're going to wrap up now, but is there another thought that you have that you just wanted to share?
I think overall, just if we go from a passive role into a more active role and really see that we can also help surgical outcomes, not just the surgical team, but we have a role, we're going to be so much better off because that gives us the empowerment we need, right?
Oh, I appreciate that. Thank you so much for coming. I feel like I know a lot more now than I did before we walked in here.
Yeah.
So if you have not subscribed to our podcast yet, I would love for you to subscribe. I would like for you to like this episode and then share this. This is a tool meant to help someone who may need this. Thanks again, Fern.
Yes. Thanks for having me.